The risk of becoming severely ill with the virus appears to increase among people with pre-existing non-communicable diseases, such as cardiovascular diseases, chronic respiratory diseases, diabetes, and cancer. Here are a few tips for people living with NCDs on how they can protect themselves during this pandemic. Continue to take your medication and follow medical advice. Secure a 1-month supply of your medication or longer if possible. Keep a distance of at least 6 feet from people with a cough, cold, or flu-like symptoms. Wash your hands often with soap and water. Quit smoking and avoid using coping strategies involving alcohol or drugs. A healthy lifestyle will make all bodily functions work better, including immunity. Eating healthy diets with plenty of fruits and vegetables, keeping physically active, quitting smoking, limiting or avoiding alcohol intake, and getting enough sleep are key components of a healthy lifestyle. The Ministry of Health encourages persons with non-communicable diseases to manage their conditions as much as they can so they do not end up in the hospital. For more information, go to coronavirus.gov.bn. Stay well, Bermuda.
This is a message from the government of Bermuda.
Good afternoon, Bermuda. Thank you for once again letting us into your homes for today's updates on COVID-19 in Bermuda and the work being done to safely reopen our economy and get people back to work so they can provide for their families. This evening, we will hear from the Ministers of Health, Finance, and Education. We also have Dr. Michael Ashton of the Bermuda Hospitals Board, Infectious Disease Specialist, and we're joined also by the Minister of National Security, the Honorable Wayne Kane, and also the Chief Medical Officer, Dr. Cheryl Ball, in case there are any questions. Tomorrow, we officially begin Phase 2 with the expansion of services. As a reminder, this phase of safely getting back to work includes retail stores will be open for in-store customers and will follow the same alphabetical shopping days in place for grocery stores. Beauty salons and barbers will be open under strict public health requirements. Restaurants will be open for outdoor dining only. Restaurants and licensed bars with outdoor facilities will only be permitted to open with approval of the Ministry of Health and the Environmental Health Team. Outdoor weddings and funerals will be permitted with a maximum of 20 persons in attendance, subject to the proper wearing of masks and appropriate physical distancing. These two services are the only times where more than 10 persons can be gathered. Apart from that, the restrictions for gatherings of 10 in public and private remains. Requirements for those boating to be from the same household have been removed, but still, only a maximum of 10 people will be allowed on any vessel, subject to appropriate physical distancing. Additionally, we have determined that the same provisions will be applied to allow commercial or charter boat operations, a maximum of 10 persons, including crew, subject to appropriate physical distancing. Tying to another boat is still prohibited, and boats are still required to be off the water by 7 p.m. Playgrounds will be open, and licensed daycare centers can apply to the Minister of Health to again open their doors for childcare. The use of outdoor gym equipment in our public parks is now to be permitted, with the public reminded to sanitize the equipment prior to use. Remote working and working from home is still required where reasonably practical. Buses have begun operating on a limited schedule, and all businesses are still required or permitted to operate between 7 a.m. and 9 p.m., as the 10 p.m. to 6 a.m. curfew will remain in effect. Now, the Minister of Health will provide the latest update on COVID-19, and Dr. Ashton will provide an update on the convalescent plasma at the Bermuda Hospitals Board and also answer any related hospital questions. Minister of Health.
Thank you, Premier. Good afternoon. Between Sunday and today, there were 14 test results received by the Ministry of Health, and none were positive for COVID-19. This is not the high numbers that we have become accustomed to over the last several weeks. However, this is because the testing teams have been deployed to critical areas, including institutional and senior populations. Bermuda has 125 total confirmed positive cases, and their status is as follows. There are 36 active cases, of which 33 persons are under active public health monitoring, and 3 persons are hospitalized, of which 2 are in critical care. The total that have recovered to date are 80, and the total deceased are 9. The average age of all of our confirmed positive cases is 59, and the age range of all of our positive cases is from 18 to 101 years. The average age of all deceased cases is 74, with that age range being between 57 and 91 years. The source of all local cases is as follows. 39 are imported, 74 are local transmission with known contact, 10 are local transmission with an unknown contact, and 2 remain under investigation. Bermuda's country status remains at local transmission cluster of cases. I can also advise you this evening that a staff member in KEMH's Gordon Ward tested positive for COVID-19 earlier this week. Consequently, the Gordon Ward has been put on quarantine, although all patients were tested this week and were all negative. They will be retested again, including the staff, by the weekend, just in case any were pre-symptomatic when they were tested. BHB has had mandatory testing for many weeks for staff who have had exposure to COVID-19 or exhibited symptoms. There has also been voluntary testing for staff through our facility at the South Side, and that's been an operation for staff to voluntarily go down there for several weeks now. With increased testing capacity now available, BHB is developing a program of regularly testing staff, prioritizing front-faced patient care services. This proactive mass testing started with long-term care services staff, which includes all patients and approximately 120 staff, followed by dialysis and long-term care services at MWI, and a phased program based on risk to patients and staff. In addition, since the 1st of April, BHB has had protocols in place for testing all patient admissions as well as in-hospital transfers. While testing will help identify infections, we know that only a strategy that combines strict adherence to hygiene, physical distancing, and mask wearing can successfully contain COVID. The use of daily PPE and physical distancing, along with hand washing, not touching eyes, nose, and mouth, and respiratory etiquette remain critical in containing spread and potential outbreaks in the hospital. It is this strategy that we have to apply to all settings where we interact with people. As I mentioned at Monday's press conference, as we move into phase 2, the Ministry of Health will be creating guidance instructions with for permitted businesses and what they must do during this next phase and what it means to those particular sectors. This guidance will be posted on the government website. One further guidance document which has been created is the one for the outdoor dining that the Premier mentioned a few moments ago with respect to phase 2. Under the requirements of the Emergency Powers Regulations 2020, restaurants can offer outdoor dining and bars can use outdoor areas during phase 2. However, I must stress that the only businesses which are permitted to open and provide these services are those which have previously offered outdoor dining and outdoor bar facilities. Any businesses wishing to offer such services for the first time must contact the Environmental Health Services for approval before opening. All restaurants and bars providing outdoor services must comply with the requirements of this guidance document, and these include the following. All staff must wear masks at all times. Patrons must wear face masks whilst waiting to be seated and at all other times except for when they are eating and drinking. Bookings will be highly recommended. Walk-ins will be recorded and regulated. Physical distancing at least 6 feet must be maintained during any waiting or queuing. Guests must use hand sanitizers provided before entering the establishment. Patrons will be greeted at the point of entry by a dedicated staff member and only granted access if safe to do so when adhering to physical distancing. Clear signage must be provided at the entrance to the establishment and within the premises in relation to physical distancing, hand hygiene, and the use of masks. Only one person will be allowed to use the restroom facilities at any given time. There will be a maximum of 10 persons per table. No handshaking, fist bumping, high fives, or hugging will be allowed. The maximum number of people allowed in the outdoor bar dining area will be dictated by compliance with physical distancing. There will be accessible and visible sanitizing products for guests and staff with hand sanitizers placed at each entrance, each table, and at the waiter stations. Managers will ensure that staff regularly wash their hands and use hand sanitizer provided. All surfaces will be regularly sanitized. Once guests have left, the entire table will be cleared and sanitized. Single-use washable or digital menus will be provided. There must be a logging in of the cleaning schedules, sanitizing, and disinfecting of all shared surfaces and bathrooms. Kitchens and kitchen equipment must be deep cleaned prior to opening. Kitchens must be deep cleaned at least once per day. Packaged cutlery and single-use condiments to be provided upon request. There will be no direct service at bars, and there will be no self-service salad or buffet bars. In case of sudden inclement weather, and only where suitable covering is not provided outdoors, the restaurant may be used as temporary shelter for guests. However, in such instances, guests will not be permitted to move freely throughout the establishment. Dedicated spaces must be assigned to allow adherence to our physical distancing rules, and masks must be worn. Contact tracing is an essential part of combating any outbreak of communicable disease, and we've spoken about that on a number of occasions during these press conferences and the importance of contact tracing. And as we are still managing COVID-19 on the island, it is essential that we have procedures in place to assist in contact tracing, particularly as we move into phase 2. And therefore, the following procedures shall be followed at restaurants offering the outdoor dining options. Tables will be numbered. The party name and server will be recorded. Servers will wear name badges. There will be one server per table, and the diner or diners' contact details will be recorded. There will be a mandatory space of 6 feet between tables or physical barriers where 6 feet is not reasonable practical. Such physical barriers, if they are required, must be so designed as to adequately separate tables, and they need to be at least 6.5 feet high. There is also an extensive list of additional requirements which should be considered by establishments, which can be found in the guidance on the government website at coronavirus.gov.bm. I end by reminding us all that if we do not adhere to public health requirements, we will see an increased cases of COVID, increased hospitalizations, and increased deaths. The new normal is all about hand hygiene, physical distancing, and mask wearing for all of us. We must integrate this into our daily lives to ensure safe passage through phase 2. Even though the guidelines say not to meet in groups larger than 10, that does not mean, for example, that it is okay for you to go and visit someone's house who may have, for example, 10 people there, and then to go to someone else's house who may have another 10 people afterwards, where there's a gathering of a further 10 individuals. Now is not the time to house hop. Anyone who is within 6 feet or more than 15 minutes becomes a close contact. So consider how many close contacts you would potentially create by visiting multiple households. Also, all groups of 10 are not created equal. What do I mean by that? I mean, if you're in a group of 10 people who are only from 1 or 2 households, that is far more preferable than being in a group of 10 who are from all different households. The intermingling of individuals from different households is probably the biggest threat to stopping COVID-19 spread, and I urge you all to be mindful of this and to limit your interactions with others as much as possible. As human beings, and particularly as Bermudians, we are social creatures, but consider creating social bubbles whereby you socialize with the same group of individuals rather than meeting up with different groups of friends or family throughout the week. Remember, you could be a super spreader and not even know it. The more interactions you have with others and the more you are out and about in the world, the more at risk you are, and you put yourself and your members of your household also at risk. You can stay up to date and informed on the latest developments about COVID-19 by visiting coronavirus.gov.bm. I'd like to now introduce Dr. Michael Ashton, who is the Chief of Medicine at BHB. Thank you.
Thank you, Minister. Thank you, Mr. Premier, for the opportunity to discuss a promising therapy that has become available at BHB. To date, there are unfortunately no proven treatments for COVID-19 beyond supportive care. However, most patients will recover in time. There are some patients that would benefit from therapy. And so we have been scrutinizing the literature that is peer-reviewed and published to understand what treatment options would be best for us to explore. One of the treatment options that holds great promise, I think, is convalescent plasma. So what is this? Let's first start by saying that there are now almost 80 folks that have recovered from COVID-19 on the island. And when a person recovers from COVID-19, we can expect that they have developed neutralizing antibodies. That's the natural immune response to the virus. And this antibody knocks out the virus such that patients can recover. We understand that some patients who develop severe life-threatening disease may not develop these neutralizing antibodies. And so the treatment essentially takes neutralizing antibodies from a recovered individual and gives it to someone who has not yet recovered and may not indeed recover without it. What this does is it buys time for ultimately the patient to develop their own immune response that's appropriate and then ultimately recover. We've seen positive results from other coronavirus infections such as SARS, MERS-CoV, and preliminary data that's been published over the last few weeks suggests that the same is also true for SARS-CoV-2, the virus that causes COVID-19. Thanks to Dr. Fakunli and also to the generous donors that have already given donations over the last several weeks, we now have approximately 6 treatments that are in frozen storage and available for the most severely ill patients who would otherwise be expected to die. Looking through the treatments that are available, the courses that we have, they match actually for all of the different blood types. The protocol has been developed and has been approved by our ethics committee and also by the board of the hospital. The treatment is intended only for those patients that have severe and life-threatening disease. This is as per FDA guidance and is what is being done in other countries. Thus far, fortunately, we've not had any patients that have needed the therapy, but it is available there for those who have had an informed consent that is robust. And what I mean by that is that we have to talk about the risks and benefits of the therapy and the unproven nature of it. It's unproven, but we also have had a lot of experience with plasma in other settings, such as for certain bleeding disorders. And in fact, over a course of a year, BHB will administer hundreds of plasma transfusions. And of those transfusions, rarely do we encounter adverse events. And in the last several decades, we've not had a death from the treatment. So I hold out great hope for this treatment option. it can be further refined. We have obviously a screening process for the blood product itself, which includes ruling out other infections such as HIV, hepatitis C and B, syphilis, etc. And also we have testing that's done overseas to ensure that actually the plasma contains a neutralizing antibody. There's further testing that we hope to do, and obviously we will be monitoring with a registry all of the outcomes of the treatments that are administered. I'll take this opportunity to just share that for a donor, the risk is minimal, and the duration of the donation is usually only about 30 minutes. If you're interested, if you feel that you may have had COVID-19, or indeed if you've tested positively in the past and have recovered, we would ask you to contact your primary care doctor or the donor center. And the telephone number is 236-5067. That's 236-5067. The email address is blood.donor@bhb.bm. Essentially, one donation equals one treatment. That's one saved life. And eligibility is adults between the age of 18 and 75, both male and female. Thank you.
Thank you, Dr. Ashton, and thank you, Minister of Health. There are many who are worried about the future of what the economy may hold. The Minister of Finance has been working diligently to ensure that we'll be able to navigate the difficult economic waters ahead. I will now ask the Minister of Finance to update Bermuda on his continued efforts. Minister?
Thank you, Premier. Good evening. Our remarks this evening will cover three areas: an unemployment benefit update, the Economic Advisory Committee, and further emergency measures that will be undertaken by the government. Last week, I made a commitment that if you had been unemployed at the introduction of this program up through when you get re-employed, you will receive your benefit. Some folks may have interpreted that as meaning everyone would have been paid last week. That was our goal. We've made great progress on that front and continue to work to pay those persons who have not yet received a payment. The intended message was this: everyone eligible will get paid, and you will be paid for the period for which you are eligible to be paid. This means that if you are unemployed for 6 weeks, you will get paid for those 6 weeks, even if you have yet to receive your benefit and are currently back to work. That brings me to an important point. As we have stated previously, you are required to notify us when you go back to work. Some who believe they have not been yet paid their share may be tempted to withhold information in order to correct what you think you are owed. However, doing so would be contrary to the law and could result in your being overpaid. What is important is that we know the beginning and ending dates of your eligibility. During last Wednesday's press conference, I mentioned you could email us with details on your return to work. However, there's now an online form that should be used to confirm your eligibility more expeditiously. Please visit www.bermudajobboard.com. Follow the link at the top of the COVID-19 unemployment application, then click at the top for the Back to Work form. Last week, I advised that over 500 people had notified the Department of Workforce Development of their planned return to work. This number has grown, and we expect that it will continue to grow as Bermuda enters phase 2 of its reopening. While economic recovery may be a long road ahead, over 1,400 individuals have now returned to work. As mentioned earlier, we continue to make progress to resolve problem applications. And last week, we paid 1,241 applicants for the first time. And tomorrow, we will be processing a mid-cycle payment to get funds to approximately 250 more. We will now have paid benefits to over 9,000 persons, benefits aggregating approximately $23 million. We expect further payments to continue on a bi-weekly schedule, which means another payment next Friday. Additionally, anyone having received a payment over the last week will receive an email tomorrow provided you gave us an email address, informing you of some critical information on payment calculations. We encourage everyone to look out for this, review it carefully, and contact us if there are corrections necessary. Last Wednesday, I advised that to appropriately navigate this crisis, I would seek the input and advice from all stakeholder groups in the community, and to assist, I have established a COVID-19 Economic Advisory Committee. This evening, I am pleased to announce the members of the new COVID-19 Economic Advisory Committee. I will chair the committee, and I've appointed the following 11 people to serve as members. Ms. Teresa Chatfield, Owner-Director of MEF Bermuda. Mr. Dennis Fagundo, Co-Managing Director, D&J Construction and President of the Chamber of Commerce. Mr. Chris Ferbert, President of the Bermuda Industrial Union. The Honorable Patricia J. Gordon-Pamplin, JP MP, Shadow Minister of Finance and Health. Mr. Mark Grandison, President and Chief Executive Officer of Arch Capital Group Limited and Deputy Chair, Association of Bermuda Insurers and Reinsurers. Ms. Cheryl Ann Lister, Chair of the Bermuda National Anti-Money Laundering Committee. Mr. Michael Neff, Managing Director, Bermuda and International Wealth for Butterfield Group. Ms. Sylvia Oliveira, Chief Executive Officer, Wilton Re Bermuda and Chair, the Bermuda International Long-Term Insurers and Reinsurers. Mr. Dennis Pitcher, Chief FinTech Advisor for the Government of Bermuda. Mr. Patrick Tannock, Managing Director, AXA XL, and Chair of the Association of Bermuda International Companies, ABIC. And Mr. Steve Weinstein, Chief Legal Officer, Renaissance Re Holdings Limited, and Deputy Chair, Bermuda Business Development Agency. At today's meeting, the committee discussed a range of organizational matters, including the committee's terms of reference. This committee will provide insight and expert advice on how to protect jobs and stimulate economic activity during the economic crisis stemming from the COVID-19 pandemic. I look forward to working with this team to identify and eventually implement a series of measures to enable sustainable economic growth and mitigate the social impact of the pandemic. I am pleased to report that the government has implemented further emergency measures to assist businesses that have a pressing need for financial relief as a result of this pandemic. The restaurant and bar sectors have been particularly hard hit by a significant decline in sales volume and job losses since the COVID-19 outbreak began. Accordingly, government will immediately institute short-term relief for payroll tax to assist these sectors that have a pressing need for financial relief. Therefore, during the quarter ending 30th of June 2020, payroll tax will be set at a rate of 0 for the restaurant and bar sectors. Restaurants and bars will also cease deducting payroll tax from employees during this period. This relief is intended to ease the pressure on Bermuda's economy, and especially the pain being experienced by many Bermudians who work in this sector. We realize that this relief will result in a reduction of government revenues. I would like to take this opportunity to announce new streamlined import duty deferment for business goods. Many viewers may recall that in the budget statement delivered earlier this year, I pledged that the Customs Department will ease the financial burden on retailers by making the customs duty deferral process more user-friendly. This will assist retailers with their cash flow, as custom duty will not be paid upfront, but rather after they have sold at least a portion of their goods. In keeping with this commitment, the Customs Department will, with immediate effect, allow retailers and other commercial importers to apply for duty deferment for up to 6 months on imported goods subject to minimum surcharge. Whereas import duty is normally payable at the time each import declaration is made to Customs, by deferring duty payment, the time of payment is delayed for up to 6 months. Upfront duty payment can place a strain on a business's cash flow. This strain can be exacerbated by also having to pay overseas suppliers upfront or on limited credit terms, and with associated bank charges on each transaction. This additional cost and the administrative handling of each payment increases the cost of trading. Duty deferment will allow customs traders, in particular retailers and customs clearing agents, to increase the efficiency of payment handling, increase cash flow, and reduce costs. Long-term duty payment deferral, more than 6 months, is also available in certain circumstances. The COVID-19 pandemic has caused a dramatic contraction of the global economy and has been particularly devastating to small island economies, hitting the retail industry in Bermuda particularly hard. With the shelter-in-place order and the mandatory shutting of most retail stores during phase 1, many retailers have been forced to make difficult choices, including employee furloughs or layoffs. The retail sector is anxious to find cost-cutting measures to help keep them afloat during this crisis. Although duty deferment was not originally intended to address the COVID-19 crisis, by reducing import duty-related merchandise carrying costs, it is hopeful that this government measure might assist some businesses to cope with the economic effects of the pandemic. Detailed guidance on customs duty deferment will be published on the government portal shortly. In the interim, all questions regarding customs duty deferment may be sent by email to customs@gov.bm. Last week, the Senate passed a legislation amending the National Pension Scheme Occupational Pensions Act of 1998 to permit a person under the age of 65 who participates in a private defined contribution pension plan or local retirement product to voluntarily withdraw up to $12,000 from the period that the act was brought into force until 30th of June of 2021. To provide further support to employers and employees during this unprecedented period, it is proposed to amend the National Pension Scheme Occupational Pensions Act of 1998 to allow for a mandatory suspension of employee and employer contributions for a period ending on the 30th of June, 2021. By providing such relief for employees and employers, participating employees will see their take-home pay increase by 5%, and participating employers will also benefit from reduced operational costs, about 5% of their payrolls. This is a temporary measure that will provide temporary relief to employers and provide additional income to employees. If the suspension of contributions is taken up across the private sector, it will provide both relief and stimulus to families and businesses. The stimulus to the economy will be generated if some of the savings is converted to consumer spending in the local economy and business investment in infrastructure and improvements. This is mandatory. However, employers and employees can make voluntary contributions should they wish during this period. The government is mindful of the long-term implications on a plan member's retirement income in permitting such suspensions. However, this must be balanced against the immediate and urgent need in our community that has resulted from this unexpected crisis. Finally, the Cabinet has recently approved a suspension of social insurance contributions for employees and employers. This proposal will provide further relief to assist businesses and employees that have a pressing need for financial relief. Similar to the NPS suspensions of contributions, this is also mandatory, and employers and employees can still contribute to the contributory pension fund if they wish. These proposals are sensible and intended to ease financial burdens on employers and employees as we navigate this pandemic. Finally, I can confirm that later this week, to supplement reduced revenues and additional COVID-19 related expenditures, I will execute the $150 million facility previously negotiated with local financial institutions. This will supplement an already executed $20 million credit facility with a local financial institution. This borrowing capacity, together with current cash reserves and ongoing tax receipts, will assist the government in taking the appropriate actions to mitigate the impact of COVID-19 in the short term. Thank you.
Thank you, Minister Dickinson. Many have questions about the future of the school year and the impact this virus has had on public education. The Minister of Education will now provide an update on what Phase 2 means for education. Minister?
Thank you, Premier. Good day. I will begin my updates today by clearing up the misconceptions around schools reopening, as we've received several calls and emails from our stakeholders querying whether schools will remain closed. On Monday evening, the Honorable Premier stated that Phase 2 of the government's plan for phased reopening spanned from May 21st to June 30th. Many took this to mean that schools will not reopen before the end of school term 3. It is essential to keep in mind that the length of the phases will vary depending on how diligent we are to adhering to the Ministry of Health's protocols. For clarity, during the government's first announcement of a phased reopening of Bermuda from May 2nd, 2020, the reopening of schools was listed in Phase 3 of the reopening process. This remains the same. The Department of Education updates today will focus on the areas that our stakeholders are anxious to know for the public school system. Since schools closed in March, the Department of Education has engaged in extensive planning for the reopening of schools with the understanding that schools will have to reopen at some point in the future. Therefore, technical officers, school leaders from preschool to senior school level, and the school staff via their principals were consulted and provided valuable input for the framing of the system's plans to reopen schools. Additionally, the ministry has met with our union stakeholders, inclusive of the BIU, BPSU, and BUT presidents, who also had the opportunity to give input and feedback for the system plan. I will add that the Department of Health officers have played a pivotal role in providing the department with expert guidance concerning safety and health protocols for the system plan. Their leadership, commitment, and technical support has been exceptional. The framework of the system plan for reopening schools has been developed using accreditation standards and indicators of quality as a guide. The Department of Education has incorporated best practices obtained from school reopenings in international school jurisdictions such as Denmark and Taiwan, and guidelines outlined by international organizations such as UNESCO, CDC, OSHA, and the World Health Organization. The system plan comprises of 4 phases. 1, planning for reopening and the actions needed to resume school operations. 2, preparation of school buildings, planning to return to the building. 3, recovery, transitioning staff and students back to normalcy. And 4, implementation of a hybrid learning model, teaching and learning for staff and students who are both in school and at home. When given the clearance by the Ministry of Health to do so, our public schools will open with the implementation of physical distancing and use many of the safe health and safety protocols. I now want to give parents highlights of the work being done for the first phase of the system plan. Concern has been expressed about the recent survey asking parents for feedback on sending their children back to school. Collecting preliminary data from the parents is part of the planning process for the eventual reopening of schools. While we do not know when that will be, we have to be ready. Our quick survey was intended to get a sense of the thoughts, concerns, and perceptions of the public school families. This data will assist with the planning for the number of students who will occupy school buildings. The responses also let us know what information it needs to be communicated. Additionally, the department needed to assess staffing capacities for when schools reopen. Preliminary data from our teachers were required to obtain a sense of staffing capacities at schools if school staff were deemed vulnerable in alignment with Ministry of Health guidelines. It should be noted that this process was established by the head of public service for all heads of departments in government to follow for all public officers. We intend to open schools adhering to the physical distancing guidelines and use the health and safety protocols. Based on questions received, the following have been asked. How are we ensuring the safety and health of school buildings? The safety, health, and well-being of our students and staff are of paramount importance. Our school facilities have been inspected and deep cleaned using deep cleaning protocol guides when schools first closed in March. Since then, custodians have been working in their respective school buildings 3 times a week to clean and ventilate the buildings. Since the week of May 4th, the custodians undertook a second deep cleaning process of the schools, and inspections are presently underway. We're very thankful to the work of our custodians who play an integral part in ensuring school-safe facilities. When we are ready to reopen schools, our custodians will ensure the ongoing cleaning and sanitizing throughout the day of highly used surface areas within our schools. There are many other building protocols the department will be implementing, some of which include ensuring a current inventory of hygiene supplies at every school, posting of signs throughout school buildings as reminders of physical distancing, student education on regular hand washing, assessing the layout of classroom spaces to determine maximum occupancy of students, and posting signs to remind students of entry and exit procedures. What are the safe and healthy protocols that will be implemented? Survey results indicate that many parents want to know the details of safety and health protocols. I'm pleased to report that the Department of Health has developed draft safety and health protocols for pre, primary, middle levels, and the School for Children with Special Needs, DAME. The protocol is defined in each step of a student's journey from the time they arrive on the school premises until they depart at the end of the day. More specifically, the health and safety actions start when students and staff arrive on the premises. These protocols will govern how to drop off students, how they walk up to the entrance, and prepare to enter the building. The protocols will continue as students and staff move along hallways, engage in learning in their classrooms, use school bathrooms, eat snacks and lunch, and play outdoors. These safety and health protocols, although prepared by the Department of Health, have been vetted by school principals and their health and safety committees or COVID-19 response teams. These protocols were pre-tested on Monday this week and today at a preschool, a primary school, a middle school, and at DAME. The teams who pre-tested the safety and health protocols comprised of the following key stakeholders: the Department of Education Facilities Manager, the Safety, Health, and Transport Officer, school principals for the selected schools, school custodians and the BIU school custodian representative, Department of Health Healthy Schools Officer, Department of Education Assistant Directors, Department of Health School Nurses, and the Bermuda Union of Teachers Safe and Healthy Committee representatives. Now that we have had input from key stakeholders, the safety and health protocols will be finalized and later customized for each school. The department will undertake safety audits before any school reopens to ensure that all of the safety measures and protocols are to ensure schools are safe for students and parents and staff for reopening. What other planning is taking place for public schools reopening? In summary, other protocols being implemented include IT services, student and staff well-being, and communication. IT technicians have been working in schools since the week of May 4th, ensuring IT devices and other equipment are functional and operational. The department has partnered with EAP, who gave webinars for department education leaders, school principals, and deputy principals this week. We will offer webinars to school staff next week. I want to reiterate that staff and student wellness are of vital importance. Communication sent to staff and parents on key educational matters will continue. Once a decision is made for school opening, a comprehensive communication plan will be followed. How is the delivery of teaching and learning and services progressing? Our stakeholders are aware that the current remote learning model includes online teaching, learning, and services using a variety of applications and platforms, plus the revision of learning packets for students without devices. Teachers at the primary and middle school are following the essential curriculum to be taught and will focus on teaching students the relevant curriculum standards. As schools move forward with new teaching and learning, it is critical for parents to ensure students are available for online instruction and complete learning activities. Parents should also check that the work completed for the work is completed for their students who receive learning packets in the mail. Our senior schools are continuing with the delivery of the curriculum and programs remotely. For those students who are due to sit IGCSE examinations in May and June, the senior schools are presently following Cambridge's guidelines for awarding students assessed grades. We wish our senior students well as they prepare for the end-of-year assessments, and we applaud our teachers for their dedicated efforts to sustain teaching and learning remotely, and for preparing learning packets over the past 7 weeks. At this point, I would like to share an email I received that is a testament to the commitment of our teachers. And I quote, "I would like to share a note with you on my experience with the remote learning instruction given to my daughter by Northlands Primary School P4 teacher. During her daily Zoom sessions, the teacher covers English, mathematics, science, and/or social studies. The teacher designs her lessons and assignments to be interactive and engages with her students through the use of various digital manipulatives and resources such as video storybooks, digital libraries, and STEAM experiments. What was specifically impressive was the teacher's use of Google Classroom. Her Google Classroom is tailored to fit the needs of her students, and she has taught her students how to navigate and utilize this platform on their own. The teacher capitalizes on the capabilities of Google Classroom to assign individual assignments to her students as well as communicate with parents. Her Google Classroom is outfitted with assignments from both core and non-core subjects, music, PE, and art, for her students to complete and submit on a weekly basis. I am thoroughly impressed with the teacher's approach to remote learning and her use of digital resources in order to effectively provide instruction to her students. As a parent, your concern lies with the quality of education being provided to your student. This teacher is a great example of the commitment and adaptiveness of our public school teachers during these unprecedented times." End of quote. Let me close by saying, on Monday, the Honorable Premier stated that the department will organize an educational support program for children of parents who must return to work during phase 2. This program will enable students to continue their remote learning at a venue outside their homes while their parents return to work. The program will commence Monday, May 25th at the Cedar Bridge Academy for primary and middle school children only. The program will open to preschool children on Wednesday, May 27th. I must emphasize that the educational support program is only for children whose parents must return to work in phase 2. Only these parents should contact their school's principal. If you are not returning to work during phase 2, do not contact your child's school's principal. Lastly, we want to assure our parents that physical distancing will be practiced as well as implementation of health and safety protocols stipulated by the Ministry of Health. More details on the educational support camp will be shared later this week. We encourage our educational family to continue to use the BPS Family Feedback Form to send in your questions, concerns, complaints, and kudos about the work taking place in our schools and at the Department of Education. Thank you, Premier.
Thank you, Minister of Education. For each of the ministers here, I extend a sincere thank you to you and your respective teams of hard-working public officers in your individual ministries. On Friday, the House of Assembly will be conducting a virtual meeting, enabling the people's business to continue in spite of COVID-19 and in accordance with physical distancing regulations. As promised, we will be tabling a resolution to require a 1-year reduction in ministers' and members' salaries. This government is leading by example, and we're determined to do our part to reduce the cost of government so that we can deliver on our mandate of providing programs that support our people. I'm grateful to the support of my parliamentary colleagues in the Progressive Labor Party, and also I have consulted, as I said on Monday, with the opposition. This is especially important in these times, and in the principle of those who have more being asked to do more starts with us in leadership. Therefore, at yesterday's cabinet meeting, ministers of the government elected to take a 15% reduction on their ministerial salaries. The government has been clear throughout that we will not ask public officers to do what we are not willing to do ourselves. This Friday, the House will debate the Development and Planning Draft Bermuda Plan 2018 Extension Act 2020, which will enable consultation on the Bermuda Plan to be extended in response to the disruption caused to the original process by the pandemic, and extension to regulations for Phase 2 to June 30th. To be clear, there is no hard or fast date for the end of Phase 2. However, this extension allows the government the flexibility to respond effectively to any changes related to COVID-19. This timeline will also correspond to the end of the state of emergency on the 30th of June. Also on Friday, there will be a number of bills tabled in the House of Assembly. The Summary Offenses Amendment Act to provide changes to curfew regulations, the Emergency Powers Amendment Act and amendments to the Statutory Instruments Act, which will allow to ensure that in future declarations of a state of emergency, any particular item of emergency regulations will be tabled in the House of Assembly for parliamentary scrutiny. The Cost of Living Commission Amendment Act, which will require groceries and other stores to transmit pricing information as requested by the minister responsible for consumer affairs electronically to the government for publishing and sharing. The Merchant Shipping Amendment Act, bills to suspend pension contributions in the private sector for 1 year and to suspend mandatory social insurance contributions for 1 year, as was mentioned by the Minister of Finance in his statement. And there will also be a bill introduced to suspend pension contributions for ministers and members of the legislature. All of those bills will be debated in 2 weeks. To listen to the proceedings in the House of Assembly, you're welcome to go to parliament.bm. You can listen on radio at 105.1, or you're welcome to listen in at burnews.com. The government of Bermuda continues discussions with airlines and charter companies to arrange flights home for Bermuda residents. If you are a person who is ordinarily resident in Bermuda and you are still seeking to return home, please complete the Returning Bermuda Resident Home form, which can be found on coronavirus.gov.bm, and click on COVID-19 forms. While we work to arrange a flight from many jurisdictions, including in the Caribbean, it is important to know the number of residents who would like to take a flight to Bermuda if one was available. I know that there are many persons in Canada who are looking to return home as well, but I was pleased to know that we could repatriate 5 Bermudians who are stranded in Canada on a private jet flight, which came in earlier this week. If you have previously listed your interest with the Ministry of Tourism and Transport or the Airport Authority, you do not need to complete this form again, as they would have your contact details already. Before I move on to my closing, just a quick update from the Southside Testing Facility. They will be taking their testing on the road, and there will be a West End pop-up drive-through testing site located at the Warwick Academy this Friday from 4 to 7 p.m. This is by appointment only, and there will be no walk-ins for those of you in the West End. So if this trial is successful, there will be more pop-up testing facilities throughout the country so that people will not have to drive all the way to Southside and may be able to be tested inside of their communities. Dr. Weldon advises that they can test up to 72 people, but bookings must be made online at coronavirus.gov.bm, and you can click the link at the very top that says Health Screening Registration to check the availability. When you go there, please make sure that you click the Warwick Academy booking option. I will conclude tonight's briefing with a word of encouragement to our community and a look ahead to what is expected from all of us and what is required to put more of our people safely back to work. We have made remarkable progress in combating a global pandemic that no one could have prepared for and that many countries have simply struggled to manage. The effort that we have made, working together, leaning on each other, being there for each other, has been not for days, not for weeks, but for months. As a people and an island, we have done exceedingly well. I remain hopeful that together with the rest of the world, we have been changed by COVID-19 and this experience for the better, and that change within us lasts long after this pandemic has been relegated to the pages of history. Now is the time for us to continue to work together, continue to practice the public health measures which we have learned over the past few months. We know that physical distancing works. We know that washing our hands works. We know that limiting contact with others works. We must remain disciplined and continue to take responsibility for our actions that keep ourselves, our families, and our community safe. As we enter phase 2, there'll be greater retail opportunities together with the ability to eat out, visit licensed establishments, and get the grooming that you may have been used to. Now is the time for each of us to think about how we can continue to keep each other safe. Now is the time for each of us to hold each other accountable and for us to make sure that we remain unified and focused. Now is the time for us to step into a new future with new opportunities and a new way of working in what will become our new normal for some time to come. Many have asked me, why do we still have a curfew? Why are there so many restrictions? Why can't I shave my beard or get a wax? Why can't we raft up? Why does my boat have to be in at 7 p.m.? Why are there so many limits on our freedom? The reason is simple. We are not out of the woods yet. We are still under a state of emergency, and we must not reopen our economy too quickly. Trust and believe. I want life to return to normal yesterday as well. But just as much as I want my beard trimmed tomorrow, because we want it does not mean that it is safe to do so. We must continue to work to limit the spread of this virus, and as we continue to build our capacity to combat this virus. So this weekend and starting tomorrow, again, now is not the time to tear it. It is still cool out time. Let's keep putting in work so that we can move into phase 3. With the House of Assembly's virtual session on Friday, there will be no Friday press conference. The next press conference will take place on Monday, the 25th of May, and we will move to 2 press conference a week format, with press conferences taking place on Monday and on Thursday. With that, I'm happy to take any questions from the media.
Good evening, everyone. My Plaza here from Media. My first question will go to you, Mr. Premier, from the community. It says, although there is no parade on the 29th of May, for Bermuda Day, will it still be considered a holiday, and will businesses be closed on that day?
I'm uncertain what businesses may be open and or closed, but it is still a public holiday. So the 29th of May will be listed as it is a public holiday under law, and it will still be a public holiday, yes.
Okay.
But of course, there's no celebrations, no parades, none of that, and all of the rules apply the same as they always have.
Thank you. My second question, this will go to Minister Wilson. Which daycares have been permitted to reopen?
That's a good question. There's a process. The process is online. You have to make an application first because we want to make sure that they are adhering to the provisions with respect to physical distancing and the like. So at this point, there's only one application that's been received here to date.
Thank you for that. And you mentioned earlier about there was only 14 results in today because of the low numbers testing, because they're out testing in different institutions and seniors. Can you mention to us what institutions they're out testing to?
The corrections facility, as well as testing, will be taking place at the Bermuda Housing Trust properties.
Thank you. And my last question will go to you, Mr. Premier, is about the tracing apps that you had mentioned, I believe, earlier this week and last week. Is there any updates on that, and will it be introduced into the community soon?
I don't have an update to share. I'm happy to try to get an update to be sent to you. I know that I've seen a few emails from the Bermuda First Technology group, and I understand that there's still work that's going on between the Department of Information and Digital Technologies and along with Dennis Pitcher, the Chief FinTech Advisor. So I'll have to follow up on that. But what I will remind everyone is that healthiq.bm is still open, is still running, and we need more people to go to healthiq.bm to go ahead and to submit their information so they can self-report any symptoms and thoughts. I mean, it's very important. This is something that has been used in many countries around the world, and we're going to continue using that. However, on the technology side, I can state that the Cabinet did approve yesterday the technology solution that will enable us to move in the near future to safe home quarantine with the technology solution as the similar type of wristband solution which is used in Hong Kong, and that is something that we'll be advancing and piloting shortly.
Thank you very much.
Good evening, all. Paul Johnston, Royal Gazette. Dr. Ashton, I'd want to start with some questions for you, if I could, please, sir. If you can't hear me, just let me know and I'll speak up. You may need to speak up just a little. A little bit? Sure. How is Bermuda doing in flattening the curve, particularly in light of phase 2 beginning on Thursday? Are you happy with the direction the island is heading? And how do we avoid a second spike?
Thanks for that question. I was just commenting with Dr. Payable earlier before the press conference, and we were reflecting on how we thought that we would never be in as positive a situation as we are right now, in terms of the outcomes of the distancing measures, universal masking, hand hygiene, etc. There have been very significant sacrifices that the community have made, and it is working. In terms of the hospital's preparedness, we are cautiously optimistic, but we are poised for a potential surge if that need happen. We're hopeful that that will not happen, and if the current phased interventions proceed as they have been recommended, I expect that we will continue to have a flat curve. I don't think that we're in a position where we would be able to eradicate the virus. Even if we were, as soon as we did that, somewhere in the world, it would be reintroduced. So that's not a realistic goal. But I think a flat curve that continues much like we are seeing, or even better, I think would be a manageable approach for the hospital until we can have definitive treatments and a vaccine.
Appreciate that. Coming to you with another one. We did not hear a definitive date yet for the reopening of schools. I'm curious in general, what are your thoughts on the reopening of schools? Based on some of the pros and cons that have been learned from countries abroad who have done this. What would you like to see in place, or Bermuda's situation before schools are reopened?
So I think it's evident based on some of the reports that we're seeing that young people are not spared from the impact of COVID-19. We're still understanding that more. I will say that the inflammatory process that has been reported in the news elsewhere in the world has not been seen in Bermuda. And that's based on my discussions with the pediatricians who are clearly looking at that closely. I would certainly defer to the ministers of health and education in terms of the details, but the prevailing strategy of social distancing, physical distancing, hand hygiene, masking, if those are adhered to, then I think we will be successful with our plan.
Another question for you, Doctor, if I could. Can you tell me what is the difference between the antibody test offered at the hospital and the one being conducted at Southside? What can the test results of all of these antibody tests tell us about the level of immunity in the community, and what can it tell us about how Bermuda is faring thus far in its fight against COVID-19?
Thank you for asking that question. First of all, to clarify, the hospital has not yet implemented an antibody test. We outsource to Helix Labs through Dr. Desiree Spriggs. Also, healthcare workers have access to the Southside facility as well. In addition, as part of our protocol that I mentioned earlier with the convalescent plasma, we do testing for antibodies, but that is sent out to Quest as a specialized test to assess for neutralizing antibodies. In terms of what is the implication of the antibody results, that's still to be determined. I think that most of these tests now, as long as they have gone through a vetting process and a validation process, can likely say whether a person has been exposed to the virus. But in terms of the immune response, that is unclear at this point. In fact, we are seeing, even on the island, based on our PCR testing, that folks will sometimes be shedding virus for weeks after the original diagnosis and recovery. I suspect that that is shedding of fragments of virus that are not viable and cannot be infectious, but that's yet to be actually proven. So there are still studies that are needed. In the Infectious Diseases Society of America statement that was recently published just over a week ago, they very clearly state that the antibody testing should not currently be used for diagnostic purposes for a individual patient. However, there is value in doing epidemiologic studies. And what that will allow us to do is understand the prevalence of a disease on the island and help our physicians further interpret the PCR test and any further tests based on prevalence that's measured.
In a
Paul,
phase,
if I may just add just one thing to Dr. Ashton.
of course.
I had some statistics which might be helpful. At Southside, they've done a total of 1,015 rapid antibody tests, which have been administered both on quarantine persons, 81 persons, and in the general public, 934. And in the group of the general public thus far, 2.8 did test positive for either IgM or IgG antibodies.
Appreciate that, Premier. Dr. Ashton, if I could come back to you. In a Facebook video on April 25th, you told people they could use the BHB's online symptom checker. You said, and I quote, "It does include travel in the history, which I think is less relevant now that we've got community transmission at this point." Two questions. What definition of community transmission were you using? And secondly, why is your definition different from Minister Wilson's, who has stated that Bermuda does not have community transmission?
Thanks for the clarification. To be clear, as per the definition by WHO, we still are in a state of local transmission with clusters. That's the WHO definition. We can speculate in terms of where we have been, but currently that is the status. Thank you for that clarification.
Maybe my final question then, Dr. Ashton, if I could come back to you. We heard last week that antibody testing, again, going back to antibody testing, if I could, was being done for data collection, but the gold standard test was PCR testing. At that time, the antibody test results were not being shared with people. We're now being told that they are being given out. If the antibody test is less reliable, where do you stand on giving those test results to individual people? Do you think it's a good idea? Do you think it's problematic?
There should be an infrastructure that's in place for the interpretation of testing. That's best done through a discussion with a physician. I think these are difficult times to interpret these test results, and I would encourage patients, when they have results, to discuss it with their physicians. I often am fielding questions from physicians and can try to facilitate any themes on questions in the future.
And it's important to note, Paul, for the public's knowledge, that antibody test results, as the Minister of Health has indicated, are not released to, positive antibody results are not released to patients directly. They're released to patients' doctors. So exactly what Dr. Ashton said, that conversation could be had.
Appreciate
it. Good evening. How many staff and patients were in the Cooper ward at the hospital when the nurse tested positive last week? And who could have possibly been exposed, and have all those persons been traced, informed, and tested?
I think you mean Gordon Ward.
Gordon, yes.
Okay. Dr. Ashton, did you want to answer that, or?
Right, yes. So it's Gordon Ward. And first, I'll just say thanks to the steadfast dedication of our healthcare workers, we have safely managed numerous cases of COVID-19 for the island. We are gravely concerned about the developments on Gordon, Through the standard protocols of testing, we identified one patient that was asymptomatic but positive as that patient was being transferred from one ward to another. And that then precipitated an aggressive workup of the rest of the ward. We, through discussions with infection control, set a quarantine for that unit. So that unit is closed to admissions, visitation, et cetera. In addition, we then have undertaken testing of the healthcare workers and also contact tracing. Thus far, we have had all of the residents tested, and there are no other patients, residents that have been tested as positive. That's gratifying. Nevertheless, we did identify through testing that one healthcare worker, whether related or not, also being asymptomatic, was tested positive. And we are in the process currently of receiving all of the test results. Thus far, out of the 26 tests for healthcare workers on that ward, only one individual has tested positive, but we're about 50% through receiving all of the remaining test results, and that should be available in the next 24 hours. Suffice it to say, we take this very seriously, and given these findings and also the increased capacity of testing that's available on the island, we will be strategically testing all healthcare workers going forward on a regular basis. And the details of that, logistics, if you can understand that there's 1,800 employees that all potentially would be tested. We will be starting with high-risk healthcare workers that are at the bedside. And further updates in terms of the logistics and testing and contact tracing will be forthcoming.
All right, thank you. Minister Robain, how many teachers have said that they are vulnerable, and how will they be replaced when schools reopen?
The testing of, well, the teachers that would fall under their medical records, which would remain confidential, but we are still collecting that information to determine how and when we're able to open schools. We will be able to open them and come up with contingency plans on those that do identify as not being able to come to work.
All right, thank you. Last night, Bermuda Broadcasting reported on the 3 cargo ships that supply Bermuda. Does the government see a national security risk should one or more of the ships be taken out of action for many weeks if crew members were infected with COVID-19?
Don, we are familiar with the situation to which you refer. It's a matter that we're looking into. We believe that we have a robust plan to deal with our cruise ships as they come into Bermuda. We will then have and continue some conversations with our shipping lines to see if we need to test and adjust our position.
Okay. As a follow, it's been said around the world that when the virus gets into a ship, it rapidly runs through the crew. There is very little social distancing on board, and the crews can't disembark. Will the government consider temporarily exempting ships from using local pilots going on board our 3 cargo vessels in order to protect the crews from potentially catching the virus?
This is a matter that remains active, and we're working on a plan and a solution going forward. As soon as we are able to discuss it publicly, we will definitely have that information for the Bermudian public.
Thank you. What do you see as the pros and cons of amending the Employment Act to allow hotels to extend layoffs of its workers?
Okay, no problem. Thank you very much, Don. Regarding that question, the pros and cons, I think, are extensive, but we are in a particularly challenging time. This is a conversation that we discussed during our caucus meeting today. It's a conversation that the cabinet will have on Tuesday, so I'm not going to get in front of any type of cabinet discussion. The one thing that I can say is that I've been informed by the Bermuda Industrial Union president that these challenges do not exist to unionize hotels, as their collective bargaining agreement supersedes these particular provisions in the Hotel Act. So it's only really applicable to hotels that have non-unionized employees, of which there are very few here in Bermuda. But on a broader level, there are some particular challenges, and we're looking at how we can work to make sure that we are not eroding worker protections, because that's the last thing you want to do inside of a pandemic, and making sure that we balance the needs of businesses to remain liquid versus the needs of the amount of items which should rightfully accrue to an employee who may have been laid off and who needs to be terminated in order for that to happen. The Employment Act 2000 was one of the seminal acts of the first Progressive Labor Party government. It provides a number of benefits to persons inside of this country, which we never had before. It's celebrating its 20-year anniversary, and this Labor government is going to make sure that we do not erode protections for workers, but we strike a fair balance. And I think, as you've seen with the measures of which have been laid out by the Minister of Finance, we're going to strike that balance correctly. But until the cabinet makes a final determination on Tuesday, it would not be a good thing for me to speak on government policy.
All right, thank you. My final question tonight.
Oh, you calling, Don?
Accidentally hit my phone. I'm not even sure what screen it's on. Sorry.
Must be an iPhone.
A couple of questions concerning the opening of retail establishments and the number lettering system. People who have who are going back to work full time feel like this may be restrictive for them to get the grocery shopping and do their other things on 2 days when they're going back to work full time, being restricted to those 2 days, and contractors being able to get supplies to do jobs when their last name, let's say, begins with a C, and they only can go and get parts on certain days.
I'll have two answers to that. The first is that, as I stated in my remarks, that Bermuda is still under a state of emergency. And we are slowly reopening our economy to make sure that people can get back to work to provide for their families, but we're doing it in a safe as possible of a fashion. The fact still remains that if you have it open for everyone, you could run an additional risk of there being multiple people in stores to assist in these type of transmission events. And we are trying our best to make sure we minimize that. So on that particular case and instance, I recognize without question that it's a hassle. I don't like, my wife is, she gets irritated sometimes about, the correct days to make sure that she can go to the store, but that's just a challenge, and those are the times in which we're in. On the specific issue of which you said regarding contractors, businesses are still able to offer pickup and curbside service on any day of the week. So that is something that is able to be eliminated. But when we're talking about multiple persons that are inside of a particular establishment for an extended, a short or extended period of time, we're trying to minimize that as much as possible, and also to make sure that we can minimize the lines. So it is a challenge, but what we are living in right now is a time when we have to make sure that we take all necessary precautions. And I think that we are striking the correct balance. If after a few weeks, we find that there is an ability to make minor changes and tweaks, just as we did with the shelter-in-place regulations, just like we did in phase one, we'll be able to make those minor tweaks. But we're going to make sure that we do this carefully. And I don't want people to feel the need to, rush. Trust me, as I said, Don, I want like nothing more to shave off my beard tomorrow, have my barber shave off my beard tomorrow. But it's just not safe to do so when people are inside of someone's face and it's close, and we have to balance. And these are the discussions the Minister of Health, the Chief Medical Officer, and we're all making sure that we have. It's a difficult balance, but our main priority is to make sure that we reduce the possibility of transmission of this virus. As you are well aware of, know that there's a number of asymptomatic or pre-symptomatic spreaders, and we want to minimize that as much as possible.
Okay, just to clarify, you just said like a business could just decide to have curbside service rather than do the number letter system.
The numbering lettering system is for entry inside of an establishment, but the curbside can continue on the regular days.
Right, thank
and
you.
That's what the regulations, which will be published on the government website shortly, will indicate.
Appreciate that.
And the physical distancing guidelines, I think, are probably up on the website already.
Probably as we're speaking.
Yes,
actually.
probably as we speak. So that would all be clearly spelled out there. Last time when I came, I had those for members of the media, and I'm very sorry, but they should be on the website.
Right. Thank you very much.
No problem.
Good evening.
Ian, Trevor.
we haven't heard much about the situation with bus drivers and how did it fare today. Today, I received information that drivers stated that if government uses minibus to transport people, they were down tools. They also stated that they wish they are only utilizing or allowing 9 persons on the buses, as minister stated that on Friday 17 would be more appropriate. Do we think there's an impasse with the drivers? And are you considering this a crisis with bus drivers?
I don't have the up-to-date information, and I would have to defer to the Minister of Tourism and Transport. But I'm sure if you send your questions direct to the Minister of Tourism and Transport, we're able to get your response. And I'm sure the Department of Communications might be able to assist on that.
Thank you, Dr. Ashton. I'm not sure if you can ask this question, but you stated that you've been involved with new practice, new testing for COVID patients. What is the longest, most difficult patients you have at present, and the practice that you have experimenting? Are you seeing results?
So first, to be clear, the convalescent plasma has not been administered to any patients yet, only because we have not had any severely ill patients that were also viremic. We have 2 patients in the ICU currently. However, we've tested to see if the virus is present, and it's not. Often what we'll see is the first phase of infection is where the virus is replicating, and then subsequent periods of the infection are actually just the collateral damage of the body's somewhat at times inappropriate response to the virus and injury to other tissues. So for our ICU patients currently, they are struggling with not so much the virus, but the subsequent effects of the virus. And I don't believe that the convalescent plasma will be helpful in those situations. It's all about the timing to catch the virus as it's still replicating, knock it out, and still try to minimize the amount of harm to the patient from what would otherwise be the subsequent effects. I'm glad you brought up the question in terms of difficult situations. Naturally, of course, deaths are, of course, an upsetting time. Transitions in life in general are upsetting, and in terms of one of the impacts in terms of our ICU care that we're seeing from COVID-19, it appears that lengths of stay are longer than we would have expected from other viral pneumonias and sepsis. Essentially, we've had infections that have spanned over weeks, and I'm hopeful that with the use of the convalescent plasma, that actually that will shorten the duration of length of stay. And you could imagine that if you reduce the length of stay, you actually increase the capacity of the hospital, not to mention you reduce morbidity and potentially mortality as well.
Have you seen a drastic drop in numbers of positive cases at the hospital?
Thank you for asking that. On a positive note, we were at a peak of 16 active cases at that time, and now, just as of today, we're at 3 cases. So we are not seeing further admissions, and we are seeing people recover and indeed be discharged as well. We are doing testing of patients before we remove them from isolation. And so that's been 2 negative test results 48 hours apart now that we have testing capabilities to do that.
Thank you. How are the BHP family frontline workers, administration, and the frontline workers dealing with the stress of this situation right there in your face?
Well, I think that we're all recognizing the long-term impact of this pandemic. It's now months that we are all, as a world community, encountering this and struggling with it. And the psychological impact is real. many of us may not see the light at the end of the tunnel. Add to that also the uncertainties of intermittently folks now with these 2 positive results that we've identified. That's unsettling, and we take that very seriously. We recognize the impact psychologically as well. What we can do is test aggressively trace and target where we see any positive results. I don't expect that we will, but it's through that process that we will beat this virus. There are numerous psychiatric, psychological resources that are available through BHB, and we continue to try to circulate the contact information as a resource. I personally think that we're probably, as a healthcare worker population, not utilizing that as much proactively as we should as individuals, because we might think that we're invincible, but I think some proactive use of those resources is wise.
Thank you. My last question, Minister Dickinson. There is a lot of discussion on social media and in the public domain of the possibility of 10% pay cuts. Last week, Friday, the BPSU released a statement to the membership that 10% is off the table. What has been your discussion with the unions?
Well, we last spoke with the unions last week, Thursday, Trevor. I think the issue of them releasing to their members the contents of our discussions was addressed in the press conference last week, Friday. We have not heard back from the unions formally.
Evening. Hi. My last question, goes to Minister Rubain from a member of the community. They say there are some families who currently have their children in private school that may not be able to afford it after we resume life. So the question is, what is the possibility for government to reopen registration for government education?
I'm sorry, I don't quite understand the question. Can you repeat that? Slow down a little bit.
Sure. There are some families who currently have their children in private school that may not be able to afford it after we resume life back to normal when schools recommence for the next year. So the question is, will government consider reopening registration for government education, public schooling?
The only registration that we do have every year is the registration to preschool and the registration to primary one. That process has been completed already, and anyone that wishes to transfer into the system after that, there's a process for that. So if they do come to the department and fill out the appropriate application forms, they will be there's a process to consider them to enroll into the public school system, and that process is for anyone that wishes to enter the system at any grade and any level that they wish to enter.
Thank you.
No more questions? Thank you very much. Thank you to all the persons, Dr. Ashton, the ministers who joined here today. In closing, I just have a few things. On Monday, I neglected to wish a happy 89th birthday to Mr. Alan C. Frith. So, Mr. Frith, I want to wish you a happy belated 89th birthday. And I would like to say a special happy 40th birthday to Mr. Ralph Gumbo Bean Jr., captain of High Pressure FC. Bermuda, remember, tomorrow and this weekend is not the time to tear it. Let's cool out and let's all work together so that we can move to phase 3. Thank you and good evening.
This is a message from the government of Bermuda.
Anyone can be infected